Thank you for tuning in to the latest update for the COVID-19 situation and the city's response to support and protect our community. As this situation continues to evolve, we want to ensure we're doing everything we can to keep our community safe and informed. And we appreciate the ongoing support of our local media to help us communicate this important information, and I know that we have members of the public watching as well. We will continue to conduct these availabilities virtually for the foreseeable future, and that is so we can continue to adhere to the social distancing guidelines as we all work together to keep our community safe. And as we did Friday, the media is asked to email their questions to communications@hamilton.ca, and communication staff will share their questions with us for a response. As the Prime Minister said today, enough is enough, go home and stay home. People need to be mindful about that social distancing, physical distancing issue. It is very critically important that you maintain that everywhere, all the time. That means when going for walks on our trails, visiting our parks, or while you're out getting food and other essentials, keep a 2-meter distance from one another. It does not mean go out and have a pickup game of basketball. It does not mean go out to the park and do a pickup game of soccer or football. It means you've got to stay away from one another to ensure that we aren't spreading this throughout our community. So please adhere to those principles. It's very, very important. Our public health teams and our public health sector are extremely busy managing this very important issue. And the issue from a health perspective, we want to ensure that we do whatever we can to keep you safe and healthy as we help those in our community who are dealing with health issues. Our HSR public transit workers are working on the front lines to ensure those who are absolutely needing the service can easily get access to it. I'll ask the community to only travel on public transit if absolutely necessary. Transit is a requirement during this important time. Healthcare professionals, first responders, home support workers, nursing home staff all need public transit to get to the food, to get to where they need to go to do their work. And of course, you may need to do that to get food and accessories or drugs. So let's only have those that need public transit use public transit. Do not use it for joyrides or for touring or end of line and then go back again. And if you have symptoms of COVID-19, please do not take the bus to get it tested. Arrange a ride, call ahead, and make sure that you're not contaminating others as you're doing that. As we mentioned last week, the City of Hamilton is working with all 3 local chambers, chambers of commerce that is, partners to develop an approach to business continuity and economic recovery that will help position us for a full recovery following the end of COVID-19 outbreak and during, so that we can maintain some business continuity. A website has been created that provides business resources and information and ways to connect with city and chamber staff throughout the pandemic. It's www.hamiltonchamber.ca/COVID-19. I know our economic development staff are also working on some other interesting ways to support our BIAs and the business community moving forward, so stay tuned for that. And equally, our EOC, our Emergency Operations Center, is working with all social service providers, United Way, food banks, shelters, shelters for the homeless, to provide for those that are marginalized and those that are in need of food and food security challenges. All that work is underway right now as we speak. With that, we're going to share with you some further updates from public health and a perspective from actions that the city is taking from our operational perspective relative to COVID-19. So let's all continue to do our part, maintain public health practices around hand washing and soap, etc. And I'll turn it over now to Paul Johnson for an update on the city's Emergency Operations Center and some of the recommendations they're making today. Paul?
Thanks very much, Mr. Mayor. And I do want to start my remarks by saying that there was an announcement by the Premier of the Province of Ontario that came just before this press conference, and they are ordering the closure of non-essential services and businesses. We don't have the entire list of what that entails. That will have an impact potentially on city services. It will have an impact, obviously, on businesses and services that operate in the community. And we will be evaluating that. In fact, the EOC is having a meeting immediately following this press conference to review this information. And tomorrow we'll have a bit more of a sense of that. The closure of these non-essential services and businesses is set to take place essentially midnight of Tuesday, so businesses tomorrow can work towards that closure and services can work towards that closure. And the expectation by the province is they will not be open on Wednesday, and this would be in place for at least 2 weeks. So the situation, as all of us say here at the table, continues to be fluid. The Mayor touched on transit, and so I'm not going to repeat some of those comments, but we very much want to support our transit operators. I cannot say enough about how they have worked collaboratively with the management of the HSR to ensure that we can continue this vital service. We likewise have listened to their concerns and have adjusted many things accordingly. And today we want to support that more. In terms of what essential travel means, we would encourage people to take transit to get things like groceries or medication, attend medical appointments, and of course, if you continue to need to work and aren't able to work from home, we're there to help to get you to where you need to be. And many times, that's getting people to essential services in our community. So the practice of not boarding and using transit in non-essential ways really mirrors what all of us should be doing every day anyways, regardless of whether we rely on transit or not. Movement out of your home should be for essential purposes only. We remind riders of our transit system that they are to continue to board from the rear doors only and stay behind the yellow line to protect our drivers. Persons with personal mobility devices may continue to board through the front of the buses. We continue to adjust our schedules. We're adding supplemental service on selected routes and sometimes with larger buses where we can to help mitigate crowding and also to improve our social distancing. The closure of the Hunter Street GO station ticket counter is effective tomorrow, March 24th, and will be closed until at least April 6th. Customers will be required to wait until further notice to purchase any HSR fare products, including tickets, passes, darts books, taxi scripts, and renewals of the senior annual passes. Just on the senior annual pass holders, you do not need to renew your passes, even though your current pass may expire on March 31st, 2020. We want to assure you that you will not be denied service, and you will have ample time to renew your pass once service is back to normal. There is a suspension of the taxi script service, and it has been suspended until further notice. If you are a current taxi script or darts client, you may call 905-529-1717 to book an essential trip using your client ID number. You'll know that today was the first day that HSR switched to Saturday service from Monday to Saturday, and these schedules are all available at the city's website, and HSR will continue to be accessible through its various channels for users of transit. Some of you will have heard the media reports that waste collection was interrupted today as we deal with some concerns from our frontline waste collection staff. Our commitment, the same way I just talked about with HSR, is the health and safety of our staff. Unfortunately, we're not going to be able to work through these issues today, and waste collection will not continue today. And we're asking folks, if your waste collection day was today, put it out again tomorrow. We continue to work very closely with our staff, and our hope is that we can get this service back up and going in some form tomorrow. Bear with us, and we'll continue to provide regular public updates on this emerging situation. Last week, we announced strong recommendations that people avoid the use of our structures in city parks. It may not have been strong enough, our recommendation. Let me be clear. Our playground structures are closed. Signs will be placed on the structures. However, we won't be constructing fences around it, and so individuals and families will need to understand they are to keep their children and themselves off our playground structures. Residents are welcome to enjoy park green spaces when you feel it is necessary to get outside. But again, we are not encouraging the participation in groups in our green spaces. Although they are available, the comment remains the same. Stay at home unless you need to go out. In order to accommodate members of the community who may be self-isolating, working from home, or caring for others, We need to balance road safety and the reality of people needing to park more on the side of our city streets. So we're announcing the following changes and updates to our parking approaches. There will now be 30 free minutes at all municipal car parks, except the York Parkade and the Convention Center, and on all on-street meters in order to support drop-off, pick-up, and take-out services. Until further notice, enforcement of the following parking regulations has been suspended. The 12-hour time limit for parking on city streets. On-street signed time limit regulations such as 1, 2, or 3-hour time limits in residential areas. And time limit exception permits for city streets with posted time limits. Again, all of this is meant to support people to be at home. We're also suspending parking-related fines for vehicles with expired Ontario license plate stickers, commercial vehicle time limit regulations for vehicles that may need to remain on street during this time, and the above those parking offenses may still be enforced in exceptional circumstances when there's significant traffic safety and/or community concern exists. And I want to say today that I was disheartened to hear stories from our traffic enforcement folks who were using discretion but ticketing unsafe parking around some of our waterfall areas this past weekend. They were subjected to abuse that was uncalled for. They are simply trying to keep us safe while recognizing that we are in exceptional times. All other parking offenses, other than those that will be on our website that you can look at if you can't remember all of the things I've just said, all other parking offenses will continue to be enforced. This includes no stopping and no parking offenses, and this is to ensure traffic and pedestrian safety. We're also making it a priority and an ongoing priority from the very beginning of this crisis to support vulnerable residents. We have a lead that is working within our city's Emergency Operations Center that is dedicated to vulnerable sector and the vulnerable residents in Hamilton. We focused on ensuring that we can support vulnerable residents that are identified and referred by public health for assistance with food and basic needs. This includes people who may need to be self-isolating as a result of their communication and contact with public health. We're ensuring that nobody is forced to break their self-isolation simply because they cannot afford or do not have food. We're providing and coordinating emergency funding to extend services and supports at some local agencies to continue service until the end of April, particularly for drop-in services so that individuals who may find themselves homeless or without an area to access washrooms or other hygiene facilities can make sure that they do. We will be extending these services to 7-day-a-week coverage as well. We're making sure that drop-in centers have access to hygiene products and food. We have established an isolation center which will provide food and shelter to any individuals that are currently in the shelter system and test positive for COVID-19. This ensures that we can eliminate the chances of those individuals continuing to infect others within the shelter system. We are also beginning to turn our attention to online supports, particularly for children and families and older adults, to help during their stay-at-home period. We don't know collectively how long that will last, but we do know, for instance, schools are closed now until April the 6th. So we'll be looking at ways that we as the city can provide helpful tips and techniques to keep everybody sane during this at-home period. We're also hoping that this will help break some of the social isolationism, particularly our older adults are facing at this time. We are working with our housing providers also to look at ways that we can change processes to reduce contact during unit offers, unit viewing, and lease signing processes. We also noted today that the provincial government announced an injection of new funding to communities to help with a variety of issues related to those who are vulnerable, maybe experiencing housing crisis or homelessness. We're going to review that announcement and have further indications of what this means for people in Hamilton. So I'll close again by saying that once again we will be dealing with a change in the landscape. The provincial announcement today will affect city services, we expect, and it also affects community businesses and services also. But I want to end by reiterating a point that the mayor has made, and I'm sure that Dr. Richardson will make as well. We do want people only to be going out when is absolutely necessary. Work from home, stay at home, do the things you absolutely need to, but recognize that just because parks may be available or other services may be there in the community, we're not encouraging your participation there. We want you to keep the proper physical distancing, enjoy each other's company as best you can in a safe way in your own home. We'll continue to update the website as we do with all of the closures or service disruptions that happen along the way. And again, apologize for today's waste disruption and understand that we will continue to work through that today and hopefully be out with some further information about that tomorrow.
Thanks, Paul. So today I'm going to give a little bit of an update around the cases and where we're at on that front, and just talk a little bit more about physical distancing and those sorts of things. So today we have 32 confirmed cases as of noon today. That's 5 more than we reported on yesterday. Yesterday we stood at 27. We continue to have 3 individuals who are in hospital and 2 who are in a long-term care facility. That's the same facility that declared the outbreak at Heritage Green Nursing Home on Saturday. From an age profile perspective, we have 4% of our cases being over age 80, 26% 65 to 79. And those, of course, are the highest risk age groups that for complications from COVID-19. At this point, we continue to have just 2 cases that indicate that there's community spread in Hamilton. But of course, we remind you again that the situation is revolving rapidly, and the message you've heard over and over today about encouraging you to stay at home as much as possible, only going out for essential services such as going for groceries or other appointments or medical appointments or pharmacy visits, and making sure you maintain that safe distance when you're outside the home. As well, wash your hands frequently with soap and water, and cover your cough or sneeze with your sleeve or a tissue. You've heard already about the announcement to close down all non-essential businesses that was just made this afternoon, and there'll be more details coming on that piece. Just a reminder too about travelers who are returning from March break. So as of yesterday, many people would have returned home, having left before people were asked not to travel beyond Canadian borders. And so again, we're asking you to please go straight home when you've returned from your trip. We understand that you may need groceries having been away or have some errands that you need to run. Please do not go out to do those yourselves. Please go straight home and stay at home. Ask somebody else to stock your fridge or pantry or to pick up the essential items that you need. And remember that you need to stay at home for 14 days. Around our assessment centers, there have been nearly 550 people who have visited the assessment centers, one in the West End, one in the East End, since they opened a week ago today. There is a lot of work going on in the health system around planning for what the future may hold for us in terms of number of cases or the number of people who may need to be hospitalized, and they are very hard at work maintaining those front lines so that people are there to provide care. Just want to talk a little bit about this language around distancing. So we've called it social distancing up to now, and you may have heard Paul's shift in his language to physical distancing. We're trying to shift that to make it a little bit more clear and to be a bit more plain spoken about it. Because while we very much want people to physically distance from each other, we absolutely want people to connect socially to one another, to check in on people who may be at home alone, particularly those who are not able to go out because they are staying at home to protect themselves, people who are elderly, people who have weakened immune systems. They do need help, they need calls, they need contact, but they also need to make sure that you're staying well so that you can be there to help them. You can still go out, as you heard, you can go out still and take a walk. You can walk your dog while maintaining that social distancing. You can think of other things to do, and it's great work that the city's going to put together to help support people to do some things while you're at home, and we know the education system is working hard on how they might be able to continue to support education of kids while they are at home. But things like playing board games or puzzles, doing chalk art on your driveway, at-home workouts or yoga, cooking fresh meals. It's a wonderful opportunity to reconnect with fresh food and what you can do together as a family. Scavenger hunts in your yard with your kids, or maybe even starting to think about getting your yard ready for spring. So all of those are things that you can think about doing, but please remember all the while to wash your hands often with soap and water, avoid close contact with anybody that you see is sick, cover your cough, avoid touching your face, eyes, and mouth, and making sure that any surfaces that are frequently touched, doorknobs, those sorts of things, are cleaned and disinfected frequently. From a resource perspective, you can continue to find us online at www.hamilton.ca/coronavirus or call our public health hotline at 905-974-9848. You may have experienced some delays as we got things up and running smoothly and fully staffed, but we are quite up to date now in terms of returning voicemails and answering calls, so please feel free to call that line. Thank you.
Thank you, Dr. Richardson, Paul Johnson, and I'll remind everyone that we have a vast emergency operations team working full-time on all of the issues that we need to deal with as we continue to protect our community. We're getting lots of advice in the broader community, and I absorb it all, and we send it all to our EOC, but rest assured they're doing everything that needs to be done to ensure that the community is safe. The supply chain continues to be sound. You only need to buy what you need to buy for the next couple of weeks, so do your normal grocery shopping. We thank all the truck drivers out there that are delivering all of these goods throughout the community. Very important work, and that supply remains. And as the state of emergency exists in the province of Ontario, know that the grocery stores and drugstores will remain open as required. I'd like to thank our public health teams, our healthcare providers, our first responders, all of them out there on the job, working around the clock. COVID hotline continues, as Dr. Elizabeth just pointed out, and lots of calls are coming in, and thousands of them actually, and they will get to you, and they're doing their best to get to all of the calls before too long. Our EOC team, Paul Johnson, Jason Thorne, Dr. Harvey, Dr. Richardson, again, have all been working around the clock as well, and my sincere appreciation for all of their effort going forward. It's really been an astounding level of work that has gotten us to this point, and I'm sure that will continue for quite some time. It's a concerning time for all of us, Hamilton, and we need your help maintaining that physical distance. None of this works without your help and cooperation. You all have a responsibility, and you need to do your part individually. That physical distancing, so critically important. Take the time to connect with people by phone or FaceTime or messaging, but do your best to not spread this virus throughout our community, and that only happens if we maintain that physical distance going forward. And at the same time, as Dr. Elizabeth pointed out, maintain some sense of social cohesion. Connect with people, help people, offer assistance to seniors and others that might need your help to get groceries or other things in a safe way. So having said all of that, there are some other things that you can do, and I know there's a critical need here in terms of blood. I'll be donating blood shortly, and I encourage others to get a hold of the local blood donor clinics to help support. There are lots of restaurants that are doing takeout services in the community. You can certainly access those if you choose to take out food, or choose to get creative in your own cooking regime and start becoming the chef at home, then all the better. But if you can support your local restaurants on the takeout basis, that's terrific. And so together we're going to get through all of this. If we are compassionate and kind to one another, and as I said the other day, assume you are a carrier of the virus, act accordingly. Public health has lots of recommendations in terms of how you do that, and be kind to one another. We need to help one another get through this, and we will. And so we are now open to some questions from the media.
Thank you. So we have a lot of the same questions coming in, so I'm going to try my best not to duplicate and not miss anything. First question is from Samantha Craigs from CBC for Dr. Richardson. Can we get an update about the patients in Heritage Green Nursing Home? Is the patient who was at St. Joe's back at home now? And do we know how the second patient contracted COVID-19?
Thanks very much. So in terms of Heritage Green, the one person does continue to be at St. Joseph's Hospital, and we haven't had any update today in terms of how they're doing. The other person does continue to be at Heritage Green and seems to be doing well. In terms of where the virus may have come from originally, we aren't ever probably going to know exactly what happened there. Because the cases are so close together, they could both have gotten it from the same individual, but they're far enough apart still that one could have gotten it from the other. So that's probably going to be what we know about that, and we're unlikely to see anything more in terms of an explanation there.
Thanks. Next question, also from Samantha. Do we know how many people have been tested so far in the city?
That's something I'll have to get back to Samantha on. I don't have the numbers. We'll email them over to you, Sam.
Also from Samantha, is it true that COVID-19 can exist on waste collection bins for 3 days?
There's a lot of studies going on in terms of the survival time for COVID-19 on various surfaces. Suffice to say that anything should be cleaned on a regular basis, and that's why we're continuing to recommend that. It'll take some time until we know exactly how long things will survive.
This question is from a number of our reporters. What can the city do to alleviate worker safety concerns related to COVID-19, our waste collectors specifically?
So we're talking with our waste collectors. There are obvious things, gloves, and one of the things that we will be doing is asking the public. We have a great interaction on a normal basis between our waste collectors and the public. And you may have actually seen online waste collectors delivering coloring books to kids who just love when the garbage is collected. During this period of time, the public is asked to just allow people to do their work and not to approach them. It's a way we can keep that physical separation. And I know that's very different from the kind of collegial attitude we'd like to have with our public works staff, but we're going to ask the public as these services to continue to just respect the physical space that everybody needs. But things like gloves are something that we're looking at, of how and having sanitizer available within the vehicles so that there's regular abilities to clean the hands. They may not be able to get to stations for soap and water as quickly, so we may want to have that hand sanitizer available. We're working through a number of those options right now with our staff. And so this interruption of service is so that we can have a good conversation with our frontline workers about how we can make sure they're best protected. And we always do that in concert with infection control through public health so that we get the right information. And I know this is scary for a lot of folks, and we do need to, though, to make sure that the right level of protection is there. If we overuse certain types of protection, it means it won't be there for the people who really need it. So we'll be continuing to work through that with our staff and ensure that when we resume this service that it'll be done in a safe manner.
Thanks. Paul, you spoke a little bit earlier about potential impacts to the collection schedule, waste collection schedule. Can you talk a little bit more about that and talk about if the city is considering temporary bi-weekly garbage or recycling pickup?
So 2 pieces there. We hope that we can get back on track very quickly with garbage collection. At this stage, we'll ask people if it wasn't collected today to see whether we can get at it tomorrow. More information will have to come out either this evening or first thing in the morning about any schedule changes along those lines. The broader question of how we deliver service is always about multiple inputs. Do we have the staffing available to deliver that service? And is it essential that we get some of this stuff done? So we haven't made formal decisions on that. I know this will continue to be a topic of conversation at our next meeting, so I think people can hold tight. We will make adjustments temporarily to programs as we need to, and I'll refer back to the HSR decision that kicked in today. We do have less frequent amount of transit on the road, and that is a product of us being able to make sure that we provide some level of transit. So these are all temporary measures, and I just want to assure the public that any change in service that happens here is done in the context of the emergency situation we're in and the crisis we're in. We are not setting any type of city policy moving forward on any of the reactions we're making. We're simply doing the best we can to ensure services are delivered to the public, but done in a way that isn't haphazard. It's done in some kind of a consistent fashion. So the short answer is there's really nothing that isn't off, there really isn't anything that's off the table. We'll look at all the eventualities and really react as we need to from a staffing level, from a safety level, as we move through this. It also may change. As we've seen this crisis move on, things may change and levels of service may change. One of those pieces is this latest announcement today. We'll have to look at if businesses are closing for the next 14 days that we would support through city services. They were open, we were supporting them. We may now go a different direction in terms of the level of service we're providing to some of those areas of the city.
Thanks. And one final question from Samantha Craigs. Paul, can you elaborate on what type of emergency funding might be available for people with lower incomes? She's not talking about homeless people, just people with lower incomes. When would it be available, and how would people be able to access it, and what would the criteria look like?
So certainly one piece that is available or coming online is the availability through the federal government. So lower income individuals who may be eligible for some of the federal government supports, if they have jobs and have been laid off, those are available. The newest piece that I can't speak to in detail because we don't have the details yet came out around the 1 o'clock mark as well. And that is some new funding which will provide, I think, what is some gap support for those who may not be eligible for some of the federal or provincial work programs, but may not also be eligible for Ontario Works. And it's to find a little bit of a gap there if I read the announcement correctly. So again, our folks I know this afternoon are reviewing what that information means. It appears that it will happen through some kind of an application process provincially, and then locally we'd be administering those funds. So some more specifics. I hope I could have some more specifics tomorrow for folks that are really worried about their income levels, and this announcement today of an injection of some $200 million to municipalities to help with that is certainly welcome news. And that's on top of the federal government doubling some of our homelessness funding to allow us to do some emergency work in shelters. So we are seeing those investments. We just have to figure out the mechanism and exactly how we'll deliver that to Hamiltonians.
Thanks. Next couple of questions are from Tevia Morrow from the Hamilton Spectator. Can anybody speak to how many municipal workers are self-isolating after March break, and how the city is dealing with that?
So we don't have a firm number. We're working through that today, so we'll understand that as people phone in, and we have a special coding for people from an HR perspective. We didn't ask everybody before they set their vacation plans where they were going, so we have some anecdotal notion of who's away, but that number, I wouldn't have access to that until probably tomorrow.
And can we expect the city to make any changes to how the farmers market is operated? Will it be closed, or will there be a decision? When would there be a decision made?
So the first decision point will be us reviewing what the province has put in place in terms of non-essential businesses and services. If it matches up with that, it will close. We had kept some of those operations going because it is a source of food. So we'll have to look in the context of what the province is saying now. But as a source of food, we considered it to be a service that we wanted to maintain, particularly because of its location in the downtown core.
Thanks. And the last question from Tevia, is the city planning anything to help renters? In Toronto, Mayor John Tory said he's meeting with landlords and their community housing provider. Could you comment on that?
So certainly we've started to talk with our community housing providers, not only City Housing Hamilton, which operates about half of the units, but other housing providers as well. No specific relief programs have emerged yet, but we're certainly aware that for renters, some of the things that are coming out, and even some of the things that council's considering here locally, wouldn't impact renters. So there's property tax things that can be done by a municipality, but the renters wouldn't get the full benefit of that. So we'll have to look at that, and those are ongoing conversations with our housing partners.
Thanks. This is a question from Dan Takama from CBC. Can anyone speak to the impact of losing hundreds of hospital staff to self-isolation, specifically those that may have returned from international travel over spring break?
So certainly that's an issue that is under active consideration by all of the hospitals in terms of how they can be staffed and looking at what the implications are around self-isolation. We know we've seen some shifts back and forth last week in terms of the direction from the province, and I think it's pretty clear right now in terms of self-isolation. If there are critical shortages for staff, they are permitted to come back in as long as they are taking some very strict precautions while they're off. But there's extensive health human resource planning that's going on across the system right now to look at what we can do. The down staffing, of course, or the down The pulling back of elective procedures and non-essential care has been really important in terms of ensuring that ongoing supply of healthcare workers, that they're available to do the really important work that they need to do, and as well that all that gear, all the personal protective equipment is conserved for those who need it the most.
Thanks. Moving on to a few questions from Jennifer LaGrassa from CBC Hamilton as well. Most of these are related to Heritage Green Nursing Home. How is public health working with the Heritage Green Nursing Home to ensure they are appropriately following safety measures? What are those safety measures? Also, are staff required to wear masks at the home? And if people are working there, and they have traveled, are they required to stay home?
So perhaps we can go through those one at a time. The first one again.
Thanks. Are they appropriately following safety measures, and what are those safety measures?
So whenever we're dealing with a nursing home that's in an outbreak mode, whether it's COVID-19 or influenza or other respiratory viruses, we work with them to make sure that the individual who is ill is isolated, and that in the case of COVID-19, anybody who's been a contact of those that individual is also isolated. As well, on the floor when there's an outbreak declared, there is cohorting, we call it. We try to keep everybody on one floor, staff-wise, who's working there, and concentrate the use of personal protective measures there on that floor. So that's the case here in Heritage Green, where they are doing that with their second floor, where we have had the first case and then the second case. They will be using personal protective equipment, whether that's masks, gowns, gloves, all those sorts of things in an appropriate manner, while also making sure that it is conserved so there is an adequate supply across the whole system. Everybody is being asked to make sure of that. There are other measures that I mentioned previously, things like serving food on paper plates for the duration of the outbreak to minimize surfaces that are being touched by many people and coming and going out of patient rooms. So all of those measures are going on there at Heritage Green, and we're checking in with them regularly to see how they're doing, and both patient-wise as well as in terms of their measures.
And can you speak to if any of the staff working at Heritage Green Nursing Home have traveled, if those staff are staying home?
So I can't speak to specifically Heritage Green. We would have reinforced all those messages with them that anybody who has traveled should be staying home. As well, there will be people who work at Heritage Green that would have been contacts potentially of one or both cases, and so they would also be asked to stay at home.
Okay, I'm going to switch over to Joanna Furketich from The Spectator. The third case that you mentioned that was in hospital, Dr. Richardson, is that somebody who was at home self-isolating and got worse, or is that a new case, and can you speak to which hospital they're in?
That was a new case who was hospitalized, and the anticipation was they would be able to be discharged sooner. They came from the community. In terms of which hospital, I'm not sure which hospital they're in, but we can send that to you, Joanna.
Just give me 1 second to make sure I didn't miss anything here. One more question from Joanna. How many cases are we looking at that are travel-related versus how many are community spread?
So by far the majority continue to be travel-related. I think the number is 16, but I see I don't have it right in front of me, so we'll send that over to you, Joanna.
And I have just one question left, and then we'll wrap up. Many cities have declared a state of emergency, including Burlington and Brantford. What is the City of Hamilton's position on this, and why?
So I can start there, and I'm going to ask the mayor to chime in as well, because I know this has been a conversation he's had as well. So Hamilton has, the Emergency Operations Center has yet to recommend we enter into a local state of emergency. To date, there is nothing stopping us from doing our work. And I think some of the pressure is, well, everybody's doing it, does it send a message that this is important? This is important. This is a crisis. This is an emergency. I don't know that we need a state of emergency to do it, because it doesn't grant us right now anything that we're finding is a gap for us. It's not required to do it. We're not required to do it to access federal or provincial funding. Nor are we stopped from doing some of our work. And in fact, one of those additional pieces was added at the latest council meeting that was held right here, when we were granted some delegated authority through the city manager to continue to spend a bit beyond our normal spending limits and do what we need to do between now and when we can set up the new way that council will meet, which could be in a more virtual environment. So from our standpoint locally here in Hamilton, and every community may be a bit different, but in Hamilton there is nothing that is holding us back from being able to respond to this emergency on a day-by-day basis. The minute that happens, our city solicitor and myself would certainly be reaching out to the mayor and informing him that we thought it was timely to do so. But I think to do it simply from a communications or public relations perspective makes little sense. It's a tool that's there to allow you access to certain things that you need as a community. And right now, Hamilton is doing just fine.
Yeah, thank you. And it's been a bit of a debate on this issue, not internally, but I think province-wide. I fall back on the entire province of Ontario is in a state of emergency. It's clear that we're all in the same boat. There's no difference between one municipality or another, other than how we're reacting to the different issues that we're seeing in our community. So I see this more as a public relations issue than it is, in fact, helping us access anything that we need. We are able to get any resources and funding that the province and the federal government is putting out there that's available to municipalities and to our citizens. So state of emergency, we're already in one. The province has declared it. We're all in the province of Ontario, and we're proceeding on that basis. And if the public health and the EOC believe there's an advantage to adding, a declared local state of emergency, I don't see one. They don't believe there is one either. But if they do, we'll certainly explore that and put that into place if it's necessary. But at this point, we're all in a state of emergency in the province of Ontario. In fact, we're in a state of emergency in the country. And so saying it locally, is not going to make any difference. We are taking it seriously and by evidence of all the work that's been going on, and we'll continue to do so at the highest level possible. And I thank you all for your questions, and we will be back tomorrow with an update. Thank you.